Welcome to It's Your Case, brought to you by VetCT. I'm Lucy Meehan. I'm your radiologist on demand for this week. This week we're going to look at the case that we looked at last week. So we've got our 13-year-old Warmblood Gelding who had a chronic intermittent right forelimb lameness and blocked to a palmar-digital nerve block and then switched to the left fore. We looked at the radiographs in the last session and we revealed a suspected flexor compactor erosion of the navicular bone, but this was quite indistinct and ill-defined, and the owner required further confirmation for prognosis and outcome reasons. An MRI was recommended, and we're going to look through the MRI images now. Okay, on the screen we have two MRI sequences. On the left of the screen, we have a sagittal sequence. So just to orient you, we have the proximal phalanx, the middle phalanx, and the distal phalanx. This is the navicular bone here. And on the right of the screen, we have a transverse image. So this is through at the level of the green line. And we can see that this is the middle phalanx, the navicular bone, and then you can just see the palmar processes of the distal phalanx creeping in. We're going to look at the sagittal image first. So as I scroll backwards and forwards, the green line is going to show you where we are from medial to lateral, and then we'll look at the transverse images, and the green line will go into the sagittal image and show you where we are. So at the moment, we're on sagittal midline. We can see that we have in the navicular bone, so this navicular bone is all black because we were on a fat suppressed image, so we don't see the medullary fat. And you can see that we have a very bright circular lesion within the flexor compactor of the bone. And as we go laterally, you can see that that disappears. And as we go medially, we come back through that again, and then the medial side of the bone is entirely normal. So this is the lesion that we were seeing on our radiographs. So if we look at that in the transverse section, we can see that it is just occupying the sagittal ridge of the bone, very much like we were seeing in our in our navicular skyline radiograph. We can also use these images to look at the deep digital flexor tendon, both proximal and distal to the lesion, and as it goes over the navicular bone. This band of tissue here is the deep digital flexor tendon. So we can see that extending from the proximal aspect of the limb right the way down over the back of the navicular bone to insert into the distal phalanx here. We're going to just scroll proximally within the navicular bone, within the foot, and we're going to start looking at the digital flexor tendon just here at the proximal aspect of the middle phalanx. As we come further distally, and we can see that we have a sort of pointed appearance to the dorsal border of the deep digital flexor tendon. This is the lateral lobe of the tendon, and we can see that as we come further distally, that lateral lobe becomes quite irregular. So if we look at a different sequence, so these are slice match now, these are running together, we can see that as we go over this irregular part of the navicular bone, we can see we've got a plaque of soft tissue within the navicular bursa, and this likely signifies an adhesion between the dorsal border of the tendon and the palmar border of the navicular bursa. And we have some fairly well-defined soft tissue opacities just in this region, which likely signifies scar tissue due to historic deep digital flexor tendon lesions. As we come over our flexor compactor erosion within the flexor cortex of the navicular bone, we can see that we've lost the definition of the dorsal border of the tendon between the erosion and the tendon, which likely signifies we've got some scar tissue and adhesions in that region. And then if we go back to our sagittal view, and we come back to sagittal midline, we can see that we've got some quite marked periarticular new bone formation at the dorsal aspect of the distal interphalangeal joint, which we saw on the x-rays. And we can see that this distal interphalangeal joint here is quite effused. So in summary, we have marked navicular syndrome within the right forefoot with a large flexor cortex erosion and some fluid signal, so some inflammation within the spongiosa of the bone. We can see that there is mild abnormalities of the deep digital flexor tendon of the right forefoot, which is chronic in character, and we've got some suspected scars and adhesions present between the dorsal border of the navicular bone and the palmar border of the collateral sesamoidean ligament. And we can also see that deep digital flexor tendon is quite irregular at the level of the flexor compactor erosion, which suggests adhesions in this region as well. As an additional finding, we have some osteoarthropathy of the distal interphalangeal joint and moderate effusion of that joint as well. But that's likely of secondary concern to this horse at the moment. So in summary, we've confirmed the diagnosis of significant navicular disease, and we've found some additional deep digital flexor tendon disease on the MRI examination. And this has backed up our prognosis from previously. So this horse has a poor prognosis for sustained ridden soundness. We can medicate the navicular bursae of this horse, and we would usually use a low dose of steroid, triamcinolone, often in these cases. But what we find is there is a transient improvement, and lameness often recurs quite rapidly. There is quite a nice paper, if anyone fancies any further reading, discussing MRI lesions within the distal interphalangeal joint and navicular apparatus and the prognostic outcome for those, and I've attached the reference at the bottom. Thank you for listening.